Harriet Torrens had just turned 42 when she was diagnosed with ADHD. As her psychiatrist said the words, she burst into tears.
You don't expect that in the moment, but I think it's been a lifetime of not quite understanding yourself. And I kind of knew when I went in, by the time I went in, that I was probably going to get a diagnosis. But to have someone actually confirm that was quite a powerful thing.
Harriet was prescribed medication, which eased her symptoms almost immediately.
It's been a very useful tool for me. It just gets me a little bit even, gets me through the day a bit more consistently.
For more than 2 years, it worked beautifully. Then, in February, a boost to her dose was recommended, but it wasn't available. That's when Harriet's GP swung into action.
She contacted me via email and she was clearly very distressed. And her experience of being unmedicated was not only was her executive function impaired, but she was starting to feel like her mental health more generally was affected.
How are you?
It's a situation many of Dr. Chapman's patients are facing. In most cases, her only option is to cobble together a new mix of drugs.
And so then it can get really complicated because you're trying to rotate a patient from a drug to another version of a drug if it is in stock and available, knowing that we actually don't know whether or not this is going to be as beneficial for that patient.
The drug shortage is having a devastating impact on children with ADHD. Paediatrician Kim Bland feels heartbroken watching it play out.
There are families that are not giving it in school holidays and on weekends when they normally would, and mums and dads are taking the brunt of that challenge with executive function, memory, focus, concentration and emotional regulation because they want to prioritise their child being able to regulate while they're at school.
Those families are arguably the lucky ones. Some have run out completely.
At the moment, there are 2 different drugs that are short, and some of my families have just worked their way through the first shortage, transitioned to a new medication, only to be told that that's now going into shortage. So they really have nowhere else to go.
It's revealed an ugly side of pharmacy, as pharmacists stockpile whatever they can get their hands on, meaning others miss out.
It's often described as a Hunger Games effect, but we are in a global economy. We don't manufacture many medications on shore, and so when we hear that something is going to go in short supply, human nature is let's obtain as much as we can to look after our local community.
Australia has been in the grips of an ADHD medication shortage since late last year, with manufacturing issues, supply chain challenges and an increase in demand globally to blame. As for how long it will last, the Therapeutic Goods Administration is expecting it to persist until at least December. Harriet's new prescription is working and in stock for now. But it's not lost on her how different the experience could have been had her GP not been allowed to switch her medication.
If you're waiting 7 months to get into a psychiatrist, what do you do if you're waiting 7 months to get an answer?
A question many are likely to be asking. Rosie King, ABC News, Canberra.